Historically, Nigeria built a health system structured basically along with the model of the colonialists. In the Federal Capital Territory, over the years with different administrations, the health system is anchored and led mostly by seasoned health administrators who coordinate the health manpower and resources.
One of the key things is that, are you running the health system in terms of providing clear leadership and governance as it should be? And that is one of the key things we first brought up within the FCT when I was appointed. And then we look at the human resource need for health. This is a critical sector globally, in the sense that even in the most developed countries, the issue of human resource for health is now generating a lot of discussions. I wish to categorically say that we are managing a healthcare program in one of the most rapidly growing population in the world.
The plan for the city was about 1.6 million. Already you have over 3 to 4 million people in the FCT. So the pace of development is moving very fast, considering the challenges that we are having in the country generally in terms of security. A lot of people are moving into the FCT. So managing this large number of people with 14 general hospitals certainly is not easy.
The policy of this government to provide one functional primary care per ward, and that one functional primary care facility per ward should be able to perform virtually all the functions of a primary care facility. And we have moved very far in Nigeria, but we are not there yet. And these services are also to improve the quality of life.
It is worthy to note that the FCT health sector, under various prevailing circumstances, have always stood out in tackling emerging situations through uncommon dedication, just like the recent battle with COVID-19.
I came on board during the fourth wave of the COVID-19 pandemic, which started in the early part of November, and I'm happy to say that, looking at the record, from the first time in March 2020, when the virus came into Nigeria, the Federal Capital Territory Administration has done remarkably very well.
Pursuant to an improved health care, Nigeria aligned itself with global push for universal access to quality health care, and the FCT is not left out.
The recently signed NHI Act, which also make health insurance mandatory, is also a very positive way. So one can conclusively say that there is a lot of improvement in creating access to good health in FCT.
Further research has shown that the burden of healthcare delivery in the country is mostly on the government. That is why several efforts and commitment through programs meant to close existing gaps have been introduced over the years. Despite the numerous improvements in the healthcare delivery system in the nation's capital, statistics still indicate the need for more intervention in the sector. It's back to the studio.